and welcome to our live event tonight. We have another online patient meeting. I am happy to be back here with all of you as always. And there is also another guest that we have, Kate Davies. Hi, Kate. How are you feeling today?
I'm good, thank you. Really good. How are you?
All good. Happy that you have been able to join our initiative. And I would also like to let everyone know that Kate has is our ambassador and also partner. So huge thanks, Kate, for joining our initiative. All with your help, it is all possible as well. So we are happy that you are able to also, simply be with us tonight and tell us a bit on our topic as well. So thank you for that. And let me just remind everyone that Kate Davies, she's actually the founder of the Fertility Journey and co-host of the Fertility podcast. So I'm very happy to and pleased to meet you as well as have you here with us. And tonight we're having a very interesting topic, why monitoring ovulation is important when trying to conceive. And of course, Kate will be explaining you how that can be done, okay? But also she will be happy to answer all of your questions, I'm sure. So as always, please remember to type the questions in the chat section so that Kate can help you out, and I'm sure she'll be happy to do it. So just don't get discouraged. Just go ahead and ask the questions.
Please do.
Exactly. So first we will start with a short introduction from Kate, and then we will go for those like most common questions that we receive, of course, as well. And then it is time for your question. I see that someone said that cannot hear. Please refresh or try to just simply close the window and get back on. It should help. Okay, I will write you some additional tips just in case as well in a few seconds in the chat section. But everyone else, I hope you can hear me and Kate as well. Please let us know so we can make sure of that. And Kate, are you simply ready to begin?
Absolutely. 100%.
Happy to hear this. Go ahead.
Well, thank you very much for having me. I'm delighted to be here doing this question answer because I think your initiative and what you've been doing is absolutely fantastic. You've reached out to so many women and couples, and it's been making such a difference, especially in this really difficult time. So thank you very much for having me. To give you a bit of an introduction and to your listeners, as you mentioned, my name is Kate and I'm an independent fertility nurse consultant and founder of my practice, Your Fertility Journey, and that's in the UK. And I consult women and couples all over the UK and some elsewhere with regards to their fertility. I'm also an IVF coach, so I support women and couples going through IVF, and I have a particularly special interest in polycystic ovarian syndrome. I've done quite a lot of work with women with PCOS and a lot of studying in the area, so it's one of my kind of favorite areas really to work with women and men on. And what I'm going to talk to you today about is how important it is to monitor your fertility and your ovulation when you're trying to conceive. And this is whether you're trying to conceive naturally or perhaps having assisted conception. And I'm going to be also talking about the various different ways that you can do that. And in particular, I'm going to be talking about the OvuSense fertility monitor, which is a monitor that I use with many of my patients.
Excellent. Thank you so much for that. And I guess we can start with the questions, right?
Absolutely.
Perfect. So the first question is, why understanding your fertility and ovulation and empowering?
Well, that's a really good question actually to get started with, because I think when you're trying to conceive, it can all seem incredibly bewildering. And also, certainly if you're going through fertility treatments, you actually feel as though you often lose control yourself. It's very much under the guidance of your doctors. There's a lot of unknowns. It's a really difficult time. But even before that, even just starting out trying to conceive, the best thing that you can do is to get empowered and get awareness of your body and your cycles and your fertility. Because that is the most empowering thing that you can do. And it's almost like taking ownership and taking that control back, which is so important. And also, there's quite a lot of research to show that your time to conception can be significantly reduced with fertility awareness knowledge. And that's really important. I think having an understanding of your cycles, and particularly your fertile time, can make such a difference to your ability to conceive and optimizes your fertility. I think there is this massive assumption, and we're told, aren't we, in school, that, you know, you ovulate on day 14 of a 28-day cycle. But in reality, very few women have a 28-day cycle. And even if they do, very few women will ovulate on day 14. So I see so many women all the time with maybe normal cycles or short cycles or long cycles, and still they're not ovulating on day 14. And it's this kind of bit of a myth that I think within the medical profession, we perpetuate that myth. And I think it's time that we stop saying that, because it's not true. Ovulation can move from month to month and can be determined by so many variable factors. So, for example, your ovulation can be delayed if you're ill. Your ovulation can be delayed if you're under stress. Even things like traveling or change in routine can impact your fertility and when you ovulate. And one thing is for certain, over the last couple of months, I've seen some wacky cycles from ladies that were probably having really, really normal cycles, have suddenly got these longer or even shorter cycles because of the impact of stress based on what's been going on in our world over the last couple of months. So that just shows you how our bodies are so sensitive to all the different things that happen around us. So if you're having a long or a short cycle, it's particularly difficult to identify your fertile time. And that's when cycle monitoring comes into its own.
Excellent. Thank you so much for answering that very first question. And there are, of course, more questions. So let's get to the next one. So what are you looking for when monitoring ovulation?
Okay, so depending on how you decide to monitor your ovulation, you might be looking for different physiological data that might give you some indication to when you're monitoring, when you're observing your fertility and what you're looking for. But let's assume, to start with, that maybe women are looking at monitoring their temperature. So temperature is one of the fertility indicators. There are actually 3 fertility indicators: temperature, cervical mucus, and position of the cervix. And all of those 3 change throughout the cycle. So when you're monitoring ovulation, you're actually looking for that fertile time. And if I was looking, for example, at a temperature chart, I'm looking for what we call the presence of the biphasic curve. And that's showing me that the temperature, which is a direct reflection of your progesterone, is changing as you come into your fertile time, or as you ovulate. And it looks very different on the temperature chart. So that's one way of observing it. And I think I'm going to go through a little bit more in our next question about the different types of ovulation methods to determine when you're fertile. Are you still there, Caroline? Next question. In case you're not still there, I can't hear you, so I will go on with the next question. So the next question, hi, are you there?
Yes, sorry, I had a technical issue, but don't worry, I am here. But of course, yes, let's go with the next question. Apologies, it was not up to me, but I am here.
Great.
So here's the next question, right? Okay. What are the different methods of monitoring ovulation, and which are most accurate?
Okay, so this is quite a big answer, so bear with me on this one. There are lots and lots of different ways in which you can monitor your cycle. And as I mentioned, there are 3 fertility indicators, but there's still other ways. So generally, when women start thinking about monitoring their cycle, probably the first thing they'll do, especially in our very technical world that we live in now, is they'll probably think about using an app. And apps, if they're just using the date, really, so that you in an app you might put, say, for example, the date of your first day of your period, and you carry on through all the way through the cycle. And that's using what we call a calendar method. And this calendar method is literally going on the dates. So it's almost making the assumption that you will ovulate mid-cycle, depending on the length of your cycle. So if we go back to what I've just talked about in the fact that actually women don't ovulate mid-cycle, then you can see that this calendar method, where it's literally using dates, is actually notoriously inaccurate and actually quite misleading. What I see are women that are using this, and they'll come to me and say, Kate, my app tells me that I'm ovulating on, I don't know, for the sake of argument, day 16. But actually, that is so wrong. And what is unfortunately happening is that these women are relying on this calendar method, and then this is really giving them incorrect data. So they could be potentially completely missing the fertile time. Now, the fertile time is all based on the life of the egg and the life of the sperm. Now, the life of the egg is really, really short. It's about 12 hours, potentially up to 24 hours. So a really, really short window. And then when you think of it like that, you think, how on earth does anybody ever conceive in a month? How does that happen? But how it happens is the fact that the life of the sperm can live a lot longer. So sperm can live in the vagina for around about 5 days, possibly even up to 7. So therefore, you've got a much bigger fertile window. So when we're talking about the fertile window, we're talking about those few days before ovulation and the day of ovulation, and that is your fertile window. The day after ovulation, it's very unlikely that you will conceive because the egg will have gone by that point. So therefore, if you're using a calendar method and you're relying on what it tells you, then potentially you are completely missing that time. Another way of monitoring your fertility that many women perhaps will then choose to do is to look at luteinizing hormone kits. So this is measuring your LH, your luteinizing hormone. They sometimes have other words or other terminology, but LH kits are generally what people know. These are looking for your surge in luteinizing hormone prior to ovulation, but actually they are notoriously inaccurate again. They're certainly not suitable for all women, and particularly some women, for example, who have PCOS, polycystic ovarian syndrome, will naturally have raised and elevated levels of luteinizing hormone anyway. So they're going to get a lot of incorrect and inaccurate notifications that they are luteinizing. But also with women who aren't using or don't have PCOS, they can still have these inaccurate results. So for my patients, I don't recommend them at all. They're actually very expensive, and it literally is, excuse the expression, but peeing money down the drain, because you have to use a lot of luteinizing hormone sticks in a calendar month to look for that LH. So not only are they expensive, but they're actually inconsistent, and they're quite time consuming and a bit of a faff, really, if I'm brutally honest. So it's certainly not my favorite, and certainly something that I wouldn't recommend. The next way of monitoring fertility is to, and I kind of alluded to it a little bit earlier, is to look at your temperature, and in relation to with what we call basal body temperature. So basal body temperature is your temperature, kind of almost like your external temperature. So the most common way of observing your basal body temperature is to use a thermometer underneath the tongue. And this can be an accurate way of monitoring your fertility. And as I mentioned earlier, with temperature, you're looking for that rise in progesterone. So throughout the cycle, when you're monitoring your temperature, you're looking at seeing what is happening with your progesterone levels, and you're looking for that temperature rise, which is indicative that ovulation has already occurred. So that's important, that it's already occurred. So with basal body temperature, it's telling you that you've ovulated. Now, like I mentioned, basal body temperature recording can be a very accurate method. However, it can be quite inconvenient because you need to take your temperature at exactly the same time every day, in the morning, before you do anything, before you sit up, before you have a drink, before you speak to your partner, before you do anything. And that's not going to be great for everybody's lifestyle. Ideally, you need to take it, to be very accurate, you need to take it at the same time every day. And again, with our work patterns, that might not be feasible, especially if you're trying to do this and you maybe already have a young child. Then the likelihood of you being disturbed, getting up at different times, is going to be highly likely. Also, there can be disturbances in doing it. For example, if you don't sleep very well that night, if you have had alcohol the night before, that can disturb your temperature recording. So there's lots of different factors. Also, even the external temperature to some extent can influence. So how cold your room is can influence your basal body temperature. So it's a good and cheap way of doing it, but it has its issues as well. The next way that you can monitor your temperature or the psychological, physiological data is a lot more emerging now. And again, this is partly with our technical world, that there are a lot more ways that you can do it. And this has opened up fertility monitoring to so many more women and couples. And this is by using a sensor. So you can use a sensor, and this will provide the sensor with some physiological data. So for example, there are a number of monitors that use skin temperature to monitor the progesterone or the temperature, and also other data that you can provide it with. The concern about that is that skin is not an accurate recording for fertility. So whilst you might think, oh, it's lovely to have, one of the bracelets or whatever, they're not actually particularly accurate, and they're not going to give you the really accurate temperature recording. And also with skin, as I mentioned earlier, with basal body temperature, because it's your basal body temperature and it's your skin temperature, it's going to be potential to have fluctuations in various things, external temperature, for example. So again, it's not really as accurate as it would like to be, unfortunately. So the most accurate way of monitoring temperature, and this is going to make an awful lot of sense in a minute, is through what we call your core body temperature. And your core body temperature is the temperature inside. It's the temperature that your body is really, really good at controlling and keeping exactly as it should be. So it's that temperature that is so important for all our organs and our general health. So measuring core body temperature is so accurate because it's exactly what it should be. You're less likely to have any impact from any fluctuations due to external temperature, for example, or any other factors, because it's really what your body is doing and doing very well. So core body temperature, the monitor and the sensor that monitors core body temperature on the market at the moment is something called OvuSense, and that's the one that I referred to at the beginning. And I use on OvuSense with a lot of my patients based on its accuracy. And for this, to be completely transparent, and for transparency, I will say that I work alongside OvuSense, the company, and that's important to say that. But I came across OvuSense must be about 6 years ago, and came across it actually by fluke. I couldn't believe how I came across it. And at the time, the company was very, very small, and they were looking to increase their team. And I read about it and I thought, wow, this is exactly what I'm doing with my patients with basal body temperature, but it's even more inaccurate, more accurate, and even more convenient. And therefore, I was really interested in it. I was fascinated by it. I thought, this is something that I really want to learn more about, because this could be a game changer for my patients. So I got involved with a company, and like I said, I work alongside them, and I was really happy to put my professional name to this organization, because it was just doing what I really wanted it to do for my patients. So I'm going to explain a little bit more about OvuSense in my next question, but just to give you an overview, it provides a live ovulation prediction, which is fantastic, because if you are trying to conceive, you really want to know when you're about to ovulate. And as I mentioned earlier, with basal body temperature, that shows you when you've already ovulated. And based on the life of the egg, that could potentially be too late. So what ideally you want is a sensor or a way of knowing when you're about to ovulate. So OvuSense is able to do that, which is fantastic. And it's the only monitor that is able to do that. And it is also able to confirm ovulation with 99% accuracy, which is so important for a large group of women. For example, women with PCOS who may not know whether they're ovulating. It's so important that they find that information out, and because that can make a real difference. So to have that accurate confirmation is crucial.
Excellent. Sounds definitely interesting. So thanks a lot for explaining this to us. And now let's have the next question, and you will be able to tell us a bit more, right? So how OvuSense monitors ovulation?
Okay. So to give a bit more background, OvuSense is a regulated medical device. It's the only monitor to have full regulatory approval, and that's in the UK, in Europe, in Canada, USA, Australia, and I may well have forgotten some other places. So it's the only one to have that, which is fantastic. It's also research-based, and this is incredibly important to me because being a nurse consultant, all of my background is I make sure that everything I recommend has that research base to it. Otherwise, to me, there's no point in considering it. So it's got its roots in a lot of research. It's had 2 clinical trials, and it's also had 6 peer-reviewed publications. So it's got an impressive research background. So as I mentioned, OvuSense monitors the core body temperature, and it does this because if you remember, I mentioned about it being core body temperature, it's internal temperature. It does this using a vaginal sensor overnight. Now, when I say that, sometimes people are like, "Oh, what? You're going to tell me to put that where?" But actually, it's very, very similar to a tampon, although it's a firmer material. It's made out of silicone, and it's medical grade silicone. And it feels just, I guess, with like a tampon, as long as it's inserted correctly, then you shouldn't feel it. And that's exactly the case. Pop in at night. Overnight, it records 5-minute recordings of your temperature. Now that's crucial because if you remember when I went back and talking about basal body temperature, that's just one recording first thing in the morning. So what OvuSense is able to do is give you a really accurate determination of all the temperatures that occur overnight, and then it smooths out that data and it provides you with the most accurate reading. So that is a crucial part of it. And then in the morning, you take the sensor out, you wash it. All it needs to be washed in just water. It doesn't need to be washed in soap or anything like that. Just water is absolutely fine. And you then pop it to your telephone, to your iPhone or your Android, and it downloads that data. So there's no downloads that are happening while you're asleep, nothing like that, no crazy kind of waves going anywhere. It's only when you take the sensor out in the morning, pop it to your phone, and it downloads that data, and then it plots it on a chart, and so you can see everything. So it gives you that convenience of not having to worry about taking your temperature in the morning. As long as you get 4 hours sleep or whatever that night, then it can give you a good reading. Doesn't matter if you're getting up and down at night to go to a little one or anything like that. If you go to bed and you want to have sex, you just take the sensor out and then pop it back in afterwards. It's not going to cause any problems. If you go to the toilet in the night, you can just take it out and pop it back in again. So very, very easy to use. Most women find it incredibly comfortable. There are no issues with it at all. And it suits the majority of women. So as I mentioned earlier, it is able to give you that live ovulation prediction, and it actually gives you a 24-hour notification or an alert, if you like, that you're going to ovulate with 96% accuracy. So very convenient for couples who perhaps are juggling busy lifestyles and work and want to make sure that they're close and around at the kind of crucial time. So it does give you that accuracy of notification. I think it's also important to point out that, as I mentioned earlier, the life of the sperm, so any sex that occurs in those 5 days prior to ovulation can result in a pregnancy. So you don't have to worry about just finding that one day before, but certainly you've got that fertile window that you can use. In actual fact, OvuSense is able to give you an 8-day fertile window, so it gives you that little bit more time to make sure that you're going to cover off that time nicely. So, as I think I mentioned, your temperature is a direct reflection of your progesterone. So if you're plotting your temperature throughout the cycle, then you'll have a steady progesterone, and then what you're looking for is the rise. So OvuSense will give you an alert that you're going to have an ovulation, and then you'll be able to physically see the rise in temperature. And then post ovulation, your temperatures all stay elevated in the upper area, if you like. So that's what we call the biphasic curve. And then if you don't conceive, your temperature drops down after a certain amount of days in the luteal phase, which is the phase after ovulation. And if you do conceive, then your temperature stays elevated. And actually, a temperature that stays elevated for more than 20 days is almost always a conception cycle. So that's 20 days post ovulation. And as I mentioned as well, it's suitable for majority of women, including women who have polycystic ovarian syndrome, unlike some of the other monitors. And actually, also, many women choose to use OvuSense when they're going through treatments. So if they're having IUI or IVF, or they're having ovulation induction medication, then they can use OvuSense to really monitor the effectiveness of their treatment. So it gives you that ability as well.
All right, sounds really, really interesting, and sounds like lots of women would be happy to simply use it, and it would be very, very helpful. So thank you so much for explaining exactly how it works. And now it will be our last question when it comes to those most common ones, so don't worry. And so we will go then for your questions. You know what to do. Just type those in the chat section, and Kate will be able to answer them. And the question is, OvuSense Pro and cycle characteristics, what can this tell us?
Okay, so OvuSense Pro is a brand new monitor. So it's exactly the same, or very, well, I say exactly the same. It's very similar to the current OvuSense, but it's actually a next level up. And the OvuSense Pro is due to be launched in June, and I'm really, really excited about it because OvuSense Pro is actually to be used with your clinician. So it's for women and couples who have a clinician or a kind of starting their treatments. And basically it's to give your clinician more information. And the reason that this is the case is that over the years that OvuSense has been used and the research that has been done on the product, but also most importantly, the cycles that we're seeing. So OvuSense has a huge amount of data and has all this data set of thousands and thousands of women and thousands of cycles. And from this, they've been able to identify a set of cycle patterns or characteristics that we're seeing in women. And what we're finding is we're seeing these time and time and time again. And these cycle characteristics are fitting into certain areas and certain, I guess, what's the word I'm looking for? I guess they're determining potentially what is then happening later on in pregnancy or in their fertility. So it's actually helping to aid diagnosis of particular fertility issues, which is really exciting, such as PCOS. Now, PCOS can take years and years. It can take, on average, 13 years for a woman to have a diagnosis of PCOS. So that's a long time. And what we're finding is the cycle patterns that we're seeing can reduce that time to diagnosis. But it's also showing, and this is really interesting, it also seems to be highlighting the potential miscarriage risk as well. So it is very exciting. Like I said, it'll be launched in June, but we're very excited about it because we feel that it will be a fantastic benefit to both women and their clinicians in helping them diagnose fertility issues and potential miscarriage risk in the future.
Excellent. Thank you so much. Definitely sounds, as I mentioned, interesting. And that pro option, even better, right? So excellent work in such case, and it definitely sounds well, useful for many women. And well, now it is time for your questions. I only need to let you know that it seems that our Q&A session, like question mode, doesn't work right now, so we will need to manage this a bit differently, but don't worry, we will still be able to. We can see your questions, so Kate, you can see them right as well. Okay, so I will be simply reading them for you, but you can see them on the right. Just to make sure, I will click on that again just to see if it's going to show me anything, but I'm afraid it did not. Therefore, we need to simply do it the way I just explained. Okay, and just a second, because now I need to go back to the chat section. Sorry, apologies. I need to disappear for like 15 seconds. I'll be right back, okay? Apologies. I need to make sure that everyone can, that Kate also sees the chat section, because Kate, you cannot see them right now as well, right?
I can see them on the right hand side. Yes, I can see that.
Okay, so Kate, if you can see the first question, can you go ahead and do it, and I'll be right back with you. Yeah, okay, perfect. Thank you. Apologies about this.
No problem. So I think that's from Belinda. Hi, Belinda. You've asked, is the temperature being taken under the tongue the best location to test? Okay, so I think I'm not quite sure whether you're referring to basal body temperature there or OvuSense, but yes, with basal body temperature, you can take it under the tongue. You can actually you take your basal body temperature either vaginally or anally using a thermometer as well, but can be a bit tricky and probably not what everybody would necessarily want to do. If you do decide to use a different route, stick to that route. For two reasons. One, infection. You don't want to be kind of using your thermometer in different places. But also, it's quite important, if you start changing, then you will notice that there'll be a difference on your chart. So once you've chosen one kind of route, then stick with that. Let's see what the next one is. This is from K1. Hi. How quickly after ovulation does your temperature rise? For example, if you ovulate overnight, after midnight or in the wee hours of, say, Friday morning, e.g. at 1 a.m., would your temperature have risen by the time you wake up in the morning, 8 a.m., or would you only see the rise the next day, i.e. waking up on Saturday morning? Okay, that's an interesting question. I'm not quite sure whether you're referring to basal body temperature or OvuSense, but your temperature rises at ovulation, or just after ovulation. So with basal body, so you will see it after ovulation. When in that 24 hours that might happen is difficult to say. So you don't really know when your ovulation occurred in that 24 hours before, but you know that it did occur at some point during that time. With OvuSense, because it's taking so many intervals, over 5-minute intervals overnight, then you're going to have probably a more accurate pattern. But again, it's still quite difficult to know exactly when your ovulation occurred during that time. But certainly, as long as you're following that idea of the fertile time and knowing that any sex that occurs in the 5 days, possibly even 7 days prior to that ovulation, can result in a pregnancy. So it's really important to remember that as well.
All right. Thank you, Kate. I am right here, so hope you can hear me as well. Apologies once again that we are having this issue. And unfortunately, I tried to fix this, and of course our support is fixing it right now, but I'm not sure if it's going to work. But we can manage. Kate, you've been brilliant already with this. So let's get to the next question from K1 as well, right? Mm-hmm. So I use OvuSense as well. Can I also use it after ovulation to track temps during the luteal phase? I've been doing this. Inserting the sensor doesn't interfere with or hinder implantation, does it? Okay, right. K1, that's a brilliant question. I'm so pleased that you asked that, because actually I forgot to talk about the luteal phase when I was discussing OvuSense. So I recommend with my patients that if it's not a hassle and they would quite happy to do it, that you continue to use your sensor and you monitor your cycle throughout. Now, you don't need to do that forever in a day. I like to see at least 3 OvuSense cycles, because then that gives me a lot of data, a lot of information to look at. So the important thing is the luteal phase is
a vital stage in the cycle. So for somebody that might not be sure, luteal phase is after ovulation, and that's when progesterone is really important. You need to have good progesterone levels to support an implanting pregnancy, and if you like, to build up a good womb lining. So your womb lining is like a nice comfy duvet that the embryo will be able to implant and snuggle into. So having good progesterone is crucial, and with OvuSense you're able to monitor your progesterone levels by one, looking at how long your luteal phase is, and it needs to be between 10 and 16 days to support that implanting pregnancy, but also to make sure that your progesterone stays elevated during that whole luteal phase, and maybe starts to drop down the day of ovulation, day of your period, or the day before. Also, one important fact is a lot of ladies are told when they're trying to conceive that they'll go and have a progesterone blood test done, and unfortunately this blood test is called a day 21 progesterone, which makes your doctor think that it always has to be done on day 21, but actually it doesn't. It's only accurate if taken on day 21 of a 28-day cycle. And again, if we go back to what I started off talking about, in fact, these irregular cycles, and very few women have a 28-day cycle. So with progesterone, you have to time that test 7 days prior to your next period. Now, if you're not charting your cycles, that can be really difficult to know. How do you know when 7 days before your next period is? Because last time I looked, none of us have a crystal ball. But with charting, you can really get an understanding of your luteal phase length, and then you can work out generally when 7 days before your next period would be. And that's particularly important with long or short cycles. So, oh, sorry, I didn't answer the second bit. So K1, to answer your second bit, using the sensor in the luteal phase, not a problem at all. It's not going to interfere with implantation at all. You know, just like, you know, continue to have sex when you're pregnant, or when you're in your luteal phase, isn't going to cause any problems either. So no, you can happily continue to use it without any problems.
Excellent, Kate. Thank you so much for explaining that and for answering the question, and for your questions, of course, as well. Definitely, it's interesting ones as well. Okay, next question is up. If my periods are irregular, are ovulation piece takes to measure LH accurate? Did lots of relevant fertility tests and all turned out fine. I am 42 and I have been trying for 5 years with one failed IVF. When is the best time to do it, and when I am ovulating?
Okay. Hi, Linda. Thanks for your question. That's a really interesting one. And I'm really sorry to hear of your failed IVF. Because your periods are irregular, then it can be difficult for you to identify when you're ovulating. And again, it goes back to when I was saying with LH sticks, that actually you're probably having to do quite a lot over a period of time. And actually that can be quite stressful. You know, I mentioned the fact that it can be inconvenient and expensive, but actually the stress of doing it, and this is what I hear from a lot of my patients, is they find that whole thing really stressful. So yes, I mean, to answer your question of whether it's accurate, it really does depend on you and whether your periods are irregular for a reason. Have you had a PCOS diagnosis? If that is the case, then they won't be working for you. I generally find them not to be accurate, and particularly with irregular cycles. And I do worry that women will be waiting for that LH surge, and potentially, because they're inaccurate, be missing ovulation completely. So it does worry me from that point of view. When is the best time to do it? When I'm ovulating? I'm not quite sure whether you mean, Linda, when is the best time to test, or when is the best time to have sex during that time? Perhaps you could just confirm that, and then we can answer that one in a few moments.
Yes, of course. If you could just add it, then okay, I believe that Linda is typing, so let's give it a minute. It should be okay, so that we can answer, so that you can answer properly. Okay, yes. What is the best time to have sex? This is the question.
Okay, so like I said, the life of the sperm is about 5, possibly up to 7 days, and the life of the egg is very short, 12 to 24 hours. So any sex that occurs in the 5 days, maybe even 7, prior to ovulation can result in a pregnancy. So what you want to be doing, Linda, is really maximising that time before ovulation. So get yourself a reliable method for monitoring your cycles, and then really use that information to feel quite empowered as to when you need to be having regular sex. I think it's also important to say that you should actually be having sex regularly, ideally throughout the cycle. Now, I know when you're trying to conceive, sex does become all about baby making, and therefore it can be really difficult to kind of keep it going, especially if you know that you've ovulated. But there are a few reasons why it's quite important. One, if you're not using any monitors, then it's important to have regular sex so that you can make sure you catch that time. The other reason why it's important to have sex every 2 to 3 days is that actually you're going to have better quality sperm around ovulation if you're having regular sex. And the third thing, and this is really interesting, recent research has shown that if you're having regular sex, then you are reminding the lining of the womb that sperm is acceptable and that it's not a foreign body. Whereas if you're having sex infrequently, then the sperm won't be the lining of the womb won't be very receptive to sperm because it will view it as a foreign body, which I think is fascinating.
All right, perfect. Thank you so much for explaining that again. And there are like few questions left, so I just want to remind everyone we will be slowly finishing, so don't miss your chance and type in all the questions you have left. And the next question is from Laura. What would an average range be for a normal luteal phase? Does a shorter or longer luteal phase have any implications for fertility?
Okay, so a normal luteal phase needs to be between 10 and 16 days. The follicular phase, which is the phase up to ovulation, can really vary, so that can be shorter or longer. But ideally, the luteal phase needs to be between 10 and 16 days. A short luteal phase can be an issue. Generally, you won't have much longer luteal phase. As long as you've ovulated, then your luteal phase will fall within the 16 days, and that's when you'll get a period at the end of that time at some point. But a short luteal phase, so a luteal phase less than 10 days, so 9 days or less, can absolutely, yes, have implications for your fertility. And this is one of the things that with OvuSense, they've been able to identify, and again, that's one of the reasons with OvuSense Pro is that we've been able to identify that a short luteal phase can be an issue. So anything shorter than, like I said, 10 days could be an issue. Now, some women might get the odd short luteal phase, and then the next few cycles will be absolutely normal, and that's fine. It's nothing to worry about. But if you're consistently having a short luteal phase, then that can be a problem.
All right, perfect. Again, thank you so much for explaining that as well. And the question from K1 is but doesn't OvuSense only notify you after you've ovulated, not when you're going to?
Okay, that's a really good question. So OvuSense very much is working hard on determining the data that your body is giving it. So if your body is giving it good data, then it's able to give you that notification. If for some reason the data or the quality of the data is not so good, and that can be the case with PCOS, not always will women get a notification. Ideally they will, but on some circumstances they won't. Or if you've not been consistent with your use prior to ovulation, then OvuSense can struggle to give you that notification. So it really will depend on the data that your body is giving it. As long as it's good quality, then ideally, yes, absolutely, you should be getting that notification. But like I said, as long as you're concentrating on the fact that you've got that fertile window and you're maximizing that time, then you shouldn't run into any problems.
Excellent. Thank you once again for that. Okay, next question is, when it comes to measuring body temperature inside, what's the exact ovulation date? Is it usually the day before the temperature rises again?
Okay, yeah, good question. So I think, like I said earlier, we don't really know exactly in that 24-hour period when you ovulate. What you will do is you will notice that your temperatures are at a certain level, and then you'll get a rise, and at some point in that time you will have ovulated. If you're using basal body temperature, then it's an indication that you've already ovulated. If you're using core body temperature, so with OvuSense, then that's giving you an earlier notification that you're either about to ovulate or that you have ovulated. I hope that helps.
Perfect. Thank you so much once again. Okay, and next question is from Linda. When, sorry, it was already answered, right? It's the follow-up, yes. Sorry. So yes. Helen has another question. I'm single, so not having regular sex to help lining. What would you suggest? I've had IVF as one tube was removed.
Okay. So obviously, if you're single, then you can't help it. You can't have regular sex. So I don't know whether you're using donor sperm, Helen, or whether you're I don't know what your circumstances are, but you can only do what you can do. So, I mean, clearly women who don't have very regular sex can still get pregnant. So I wouldn't worry too much about it. All you can do is maximize the time that around ovulation, and hopefully that you will be able to have, you're using donor sperm. I can see that. Okay. Right. So donor sperm can be a bit more tricky. What I would say to you is definitely use a monitor, because then you're really able to identify what's happening in your cycles and when you're in your fertile time, so that you can maximize that time. Now, if you're using frozen sperm, then I think you need to, use it within the 24-hour period. So you're going to have to be quite careful when you're using that. So ideally, once you've got an idea of when you generally ovulate, then you want to be kind of using your frozen sperm 24 hours before that time. If you're a little bit too early with that, then you could potentially miss it based on the life of frozen sperm. But it is more tricky, but you would struggle to do it completely without a monitor unless you had a real awareness of when you're ovulating.
Okay, perfect. Once again, excellent. Thank you so much, Kate. And the question is, what is the usual reason for a short luteal phase, low levels of progesterone, weak ovulation? Is there a way to lengthen it? Okay.
Yeah, so low levels of progesterone can impact on your luteal phase. That's certainly what we find. There can be other reasons. So women with PCOS may have a short luteal phase. Can be other hormonal disorders that can cause that. Women who maybe have a low ovarian reserve can potentially have a shorter luteal phase as well. So there can be various different reasons for it. Way to lengthen it, there are various different ways. Naturally, you can consider acupuncture. Acupuncture is the only complementary therapy which is research-based to improve fertility, particularly surrounding IVF. Still, not a huge amount of research there, but there is some. And certainly anecdotally with my patients, I do see a really big improvement in their cycle lengths, and particularly the luteal phase, with regular acupuncture. So that might be something you want to think about. Other options are using progesterone to treat the luteal phase to lengthen that time. Now, it's a bit of a controversial subject, and not all clinicians will prescribe progesterone to support the luteal phase. They are more likely to prescribe progesterone once pregnant if you've had recurrent miscarriages. But certainly having that discussion with your clinician and asking whether that would be something that they would be willing to do if it is very obvious that you have a short luteal phase, you can certainly have those discussions.
Okay. Thank you so much once again. And the next one is up here. Usually my period is very regular. This month it started 5 days later. Does that mean my ovulation will be 25 days later than calculated due to the former period cycles?
Okay, let's get on my head. So usually my period is very regular. This month it started 5 days later. Does that mean my ovulation will be 2.5 days later than calculated? Okay, so if your period is normally regular and you actually started your period 5 days later, then who knows? Who knows? I mean, you had a longer cycle that month. So that month will have meant that you ovulated later in that cycle. The next cycle, it really depends. It's impossible to know whether you are likely to ovulate later or earlier or at the same time as you would normally do. But what is definite for sure is in the previous cycle, you ovulated later. Okay, hope that makes sense.
All right. Okay. And Anne actually added there, you can see usually my cycle is 26.6.
Okay, I'm a bit confused by the 26.6. What do you mean by 0.6? And that would be useful for me to know. I'm guessing you're saying your cycle is 26 days in length, which is okay. That's a normal cycle length. That will mean that you 26.
Oh, okay.
You're being very precise, and I like it. So that shows that you would ovulate. You probably ovulate before day 14. So it would be worth you just understanding your ovulation, your fertile time a little bit more, because it sounds as though you could be ovulating potentially quite a bit earlier, and you don't want to miss it. So I would definitely suggest getting a bit more of an understanding and awareness of your cycle.
Okay, excellent. Thank you so much again for clarifying that. And there is another question. So I would need to know if I'm ovulating as when transferring embryos, if it need to be medicated or can do natural transfer, would OvuSense still be good for me? And Helen has added that I'm doing IVF, not IUI.
Okay. Yes. Definitely. I mean, you can use OvuSense to really determine how well things are going for you during that time, as well as looking at when you're going to ovulate, which is useful information when you're having IVF. You can look at you can monitor the success of the medications that you're taking, and in particular the luteal phase as well. So yes, I would say OvuSense would absolutely be good for you, and certainly a lot of women who are having IVF will use it during that time as well.
All right, perfect. Thank you so much once again. And well, someone is typing, so I just want to wait and see. For now, at least, it has been our last question, but of course, I just definitely want to make sure you have asked all of your questions. And in the meantime, Kate, there is something you would like to add, right? So if you could tell us about OvuSense and what you have prepared for our patients as well.
Yes, absolutely. Well, with OvuSense, the lovely manufacturers of OvuSense, who are a really lovely team, at their heart is everything about the patient. The patient is at the heart of everything that they possibly do. And they would love to offer anybody who's on the call tonight a discount if you would like to purchase OvuSense. So to do that, you just need to go onto the OvuSense website, which is www.ovusense.com, and you can input the code KATE. So that's a really easy one to know. And I think it will give you 20% off. So that's quite a nice little bonus. So if anyone would like to do that, please feel free.
Definitely. So thank you so much for that opportunity. I mean, so everyone go ahead and just take a look at it, and just remember, you need to simply put Kate, and then you will have a discount. So definitely very, very nice. As you can see, there are some patients that are happy about that.
So it's a pleasure.
Thank you so much. And in the meantime, there was another question. So if you could add anything, you made a very good point. I never realized about the day 21. A progesterone test is only relevant if you have 28-day cycle. We have ICSI, so not sure what to say to consultant. Anything you could add?
Yeah, I mean, thank you, Belinda, because I think it's important, that I'm really pleased that we kind of talked about that, because it is an issue. And what I find is that women who will have a progesterone taken and it's timed inaccurately are then given the devastating diagnosis that they're not ovulating, which most likely isn't true because the test was timed inaccurately. But that's devastating. To be told you're not ovulating is hugely devastating. And then what will then happen is that then treatments will be recommended based on the fact that you're not ovulating. Now, I don't know whether that was necessarily the case for you, Belinda. I can see that you're having ICSI, so there might be that there could be some other issues with male fertility factor, or whatever reason you've been recommended ICSI. But I mean, certainly, if you don't know if you're ovulating, find out if you're ovulating, start monitoring your cycles, and really make the most of this empowering information. And you never know. You never know.
Excellent. Thank you once again for that. And well, okay, Belinda has added also, as you can see, my cycles change each month from 28 to 31 days.
Right. Okay. Yeah. So 28 to 31, I mean, that's really normal, Belinda. I mean, I often see women with 90-day cycles and plus. So, 28 to 31 is perfectly normal. Actually, once you know you're ovulating, that window is very small with the movement of ovulation anyway. So as long as you're having that regular sex 5 days before, and if you're using a monitor to really, really nail that time, then that would be really helpful.
All right. Excellent. And as you can see from Helen, there is a follow-up. If you could take a look, what you said about fresh and frozen sperm with IVF ICSI, if you could explain.
Yeah, I was talking, I think that was in relation to, was it you, Belinda, when we were talking about?
Helen.
Was it Helen? Yeah, so when I was talking about frozen sperm, we were talking about using donor sperm, and that was with regards to, well, I was talking with regards to home insemination, but that might not necessarily be the case. So for Helen, if you are using fresh and frozen sperm and you're having IVF and ICSI, then that's fine. You don't need to worry about that. My mistake, I think I thought that you were using home insemination.
Okay, perfect. Thank you for clarifying. If anyone would like to add anything, this is your time as we will be finishing, but I would already like to thank all of you for joining us tonight, for your questions. I am sure it was helpful. Kate, as you can see, there are definitely thank yous right here, and someone already said that really informative webinar. So thank you, Kate, for joining us tonight. It's been a pleasure to have you. Thank you for clarifying everything, and well, for that option to use OvuSense as well with a little bit of a discount. I'm sure that some of you will be happy to use it. So huge thanks for it. And well, is there anything else you would like to add?
Well, just to say that ladies that do decide to use OvuSense, you actually get as part of your package, you get a complimentary consultation with either myself or one of my nursing colleagues. I have a team of nurses. So you will get to chat to us, and we get to talk to you about, not just about your OvuSense, because we worked in a very independent and unbiased way. So we will be giving you a full fertility consultation and advising you on how you can optimize your fertility in every single way, and then looking at your OvuSense and giving some feedback on your hormonal health. So I would love to chat to any of you. And Helen, to answer your question, I'm based in the UK. I see my own patients, so not OvuSense patients, but I also see my own patients wherever you are in the world. So by video, by the wonders of video, which has been fantastic for lockdown, because my business hasn't changed at all. I've been working really hard.
So yes, that's good to hear then, of course. Yes. And well, and I would like to mention that if you would like to get in touch with Kate, you can also use this link, as there is an option to ask your questions. Once you click on that, Kate will be happy to get back to you with some help. And of course, you can also schedule a consultation, I am sure. So okay, yeah. Helen asked once again. So Helen, to answer your question, because you were cut off, Kate is in the UK, right?
I'm in the UK, Helen. Yes, absolutely. Yeah.
Exactly. So you can get in touch with Kate, and I'm sure she'll be happy to help you out as well. And again, I just want to thank everyone once again for joining us tonight. And let me remind that this has been recorded, so you will have a chance to watch this again if, of course, you would like to double check anything at all. And this will be fun. You can find this on our website, myivfanswers.com. You can also use the link I have just sent to you the video will be uploaded right there within the next few days. And if you simply subscribe to our YouTube channel, you will be notified when the new video is uploaded. So this is the easiest way to find out when it is on. And well, thank you once again, Kate. It has been a real pleasure to meet you and be able to have this webinar with you. And thank you so much for joining our initiative. And well, have a lovely evening, and I hope we can do it again.
Thank you all. Lovely to chat to you all. Thank you very much.
Thank you.
Hey,
bye.
Bye.